The Ontario Renal Network works with all of our partners to lessen the burden of kidney disease for people living in Ontario and for their families. We also work to support providers who are providing the care for our patients and families. Just about a year ago, we released the second renal plan. It was a result of almost a year's worth of consultation all over Ontario. We met with communities, patients, families, providers, and physicians, and we got their advice on how best to execute our mandate and to work on their behalf to lessen the burden of kidney disease for Ontarians. As a result of all of that consultation, we put together a plan that I believe is very patient-focused and is a result of what we heard.
The most important thing about it is patient-centered care. This means that plan encourages our renal programs, our renal caregivers, our doctors, our nurses, our care teams to consider the patient front and center, to consider the patient's wishes, interests, personal situation when prescribing treatments for chronic kidney disease. The type of dialysis, whether the patient will have a transplant or not, whether the patient will even do dialysis or not. These are serious issues that do require interaction between the team and the patient, and the principles of patient-centered care and shared decision-making are central to this new Ontario Renal Plan.
I think PFAC has a very important part to play with the design of the system with the voice. We are the ones who are inspired by our experience and what we go through in life. Like as CKD patients, we can strive to better help the decision makers to understand what patients need.
There are three strategic goals to the plan. The first one is empowering patients and families to be active in their care. The second goal of the renal plan is to integrate and coordinate care for patients so they see a continuous provision of care across their journey of kidney disease and treatment. And the third goal is about access to care. So no matter where people live in Ontario, they get the same type of service, the same quality and the same access, no matter what their travel time or what their home conditions are.
Having patients and family engaged and actively involved in their care. They're the ones that are receiving the care, and they're the ones that can tell us how we can change and improve the care that we're providing for them.
The first renal plan was very comprehensive, and it laid the foundation for our work going forward. And the second renal plan builds on that foundation and just takes us to a new level, both in care, measurement, performance, and a patient focus for both the patients and our families and providers all across the renal system in Ontario.